Dr. Lisa Ravindra from Rush University Medical Center here in Chicago. Doctor, thank you so much for being with us. We appreciate it.
Yeah, thank you very much for having me.
What are you seeing in your own practice this year in terms of the flu?
So I haven't seen any flu cases at all this year, which is really unusual for this time of year. Usually we'd see multiple hundreds of cases. But I think there's a lot of reasons for that. So you touched on it in the segment, but wearing masks, hand washing, social distancing, working from home, school from home. It's just less opportunities for respiratory viruses to spread, and that includes the flu.
It's funny, I've heard people say that maybe if we have to find a silver lining during this age of COVID is that people now coming out of this have gotten much more in the habit of washing their hands because of all this than perhaps we were before, which is a gross thought in one way, but a kind of a comforting thought going forward that maybe we're going to pick up some helpful, healthier habits because of living through this pandemic.
That's right. Yeah, I'm hoping that in the future we'll be wearing masks with any respiratory illness, that even when COVID is controlled, that we continue to wear masks with fevers or coughs, continue to wash hands. And I hope that we also continue to highlight the importance of vaccines. So I'm so pleased to see how many Americans have gotten the flu shot. And in my practice, I've seen people be more proactive about asking for the flu shot, which has been great, rather than me having to remind people. So that's been a great change.
And for folks out there who may be skeptical of shots for whatever reason, whether it's COVID or the flu, you would say?
There is so much science behind this, and they are so much safer than getting the actual diseases. So I would encourage, there's still time to get the flu shot. There's still time that we could see the numbers of the flu increasing. So really important to still get the flu shot now to help have that extra layer of protection.
And one last question. I just want to reiterate one point that was in the segment before you. You know, obviously everyone is on edge right now in terms of COVID. So distinguishing the difference between, oh man, I may have the virus, and oh, I just have a cold or a little touch of the flu. How do you distinguish that difference again?
No, it's really impossible just by talking to a patient to determine which one they have. So we rely on testing a lot. So now that testing is more widely available, it's easier to do that. But to be safe, anybody that has any type of symptoms, anything that's different than their baseline health, should consider quarantining or isolating for the 10 days that's recommended, because there really is no way to know. So the loss of smell and taste is probably the most specific symptom for COVID and wouldn't necessarily be related to influenza, but everything else, fatigue, muscle aches, cough, shortness of breath, can all be related to the flu as well.
I know we have a long way to go, but at least it's somewhat encouraging that the double whammy that people feared of the height of the pandemic and the flu colliding doesn't appear to be happening. That's certainly some good news at a time we need some. So, Doctor, thank you so much for being with us. We appreciate it.
Thank you.